mean, what it can do for Kenyans, and of course the various efforts that various other stakeholders who are working with government and other players to be able to enable Kenyans to enjoy this sort of service. I have with me in studio Professor Marion Lynch. She is Deputy Medical Director at the National Health Service, England South.
Yes. Karibu
sana.
Hello, thank you for inviting me.
Yeah, so I think a good place to start would be basically to explain to many Kenyans, because from where we literally have been in the past, the concept of a universal health service is relatively alien, relatively new. What would this look like?
A universal health service would ensure that everybody had access to the health that they needed, not necessarily that they wanted, but they needed from before their birth, so from before conception right through to the end of their life. And what we're doing in England is separating that out into specific groups. So, for instance, the first 1,000 days is something that's happening in Kenya as well. So from preconception to the second year, women and babies get the maximum health care that they need in terms of nutrition, food security, food safety. And we do that in England as well with community workers.
Yes.
Then at the end of life, the last 1,000 days, how do we look after people with dementia, with what we call non-communicable diseases?
Yes.
And in Kenya, that's going to be a big issue as well. You have, like we do in England, a time bomb of diabetes and coronary illnesses that come from how we live. The difference between England and Kenya is that our illnesses come from affluence, really, whereas many in Kenya comes from malnutrition. And therefore, the work that other people are doing in Kenya, such as Tushindi Trust, are trying to address the issues of malnutrition, which will then prevent disease, illnesses and infections early on, lower cognitive abilities, which means that people can be more economically viable in the middle, and then less non-communicable diseases.
Let's then talk about the fact that one of the major challenges Kenya has seen thus far, it comes about when you have a limited number of facilities, a huge number of people who need services, and the thinking had been that with sort of universal coverage, the major hospitals that the more affluent Kenyans do go to will then get overrun. Do you think that fear is founded or not?
I think it's founded. I think we create a business in health quite often where if there is a service, we want to use it and it becomes overwhelmed.
Yes.
Whereas what works with universal healthcare when there are people with very little money is a system that supports a community, a family in a community, in a small group, rather than building big hospitals that then everybody will go to. And that requires a different investment, an investment in community health workers, an investment in community nurses, an investment in education of the community, rather than investment in buildings for treatments that sometimes won't actually prolong life or even improve life.
And actually that is very interesting, because part of the challenge has been that for many Kenyans, the more proactive prevention, basic measures have not been present in the first place. Talk to us about what exactly it is that you're doing now that you are here in the country, and what the various projects out there in the low-income areas have been trying to do to drive this sort of agenda.
At the moment, we're working in Mathare, which is one of the slums in Nairobi, and the data we're there because the data shows us that we have a lot of stunting of the children and a lot of diarrhea. These come from malnutrition.
Yes.
And whilst they have malnutrition now, we know that 1 in 13 children will die, and if they don't die, they'll be slower than they should have been, and so not get jobs that they could have got, and then get ill. Yes. So what we're doing is trying to address malnutrition and help make families economically viable. So we have the Fiona Foundation for Kids has set up Fee Daycare, which is daycare provision so that mums can actually go to work knowing that their children are safe. And within that daycare provision, we provide food, because food security is crucial. And 2 meals a day for your child whilst you're at work means a mum can actually progress and go to work every day.
Two things you've said which are very key. First off, the fact that there is a direct linkage between economic performance later on in life and how you did get some sort of either feeding and nutrition earlier on. What exactly does this essentially mean for economies such as this, where there's such little investment in terms of getting people to start to grow in a holistic and sustainable fashion?
Let me give you the big numbers then.
Yes.
Across the world, 881 million people live in slums. Whilst the proportion is going down across the world, the number's going up, and the numbers in Africa living in slums is rising. By 2030, there will be 2 billion people living in slums. Now, 80% of the workforce is informal workforce living in slums. So economically, that's our workforce. And we have a health time bomb in slums with non-communicable diseases, diabetes, obesity, etc. And that's our workforce. So if we are ignoring the prevention work of that big group in that area of our workforce, we're not going to be able to have people be economically viable, or communities, or a country. So the investment in prevention is crucial. Whilst we're investing in acute care and hospitals, etc., we need to also look at prevention. How are we actually enabling mothers to look after themselves while they're pregnant or not get pregnant? Or how are we helping families have their children with them and stay healthy? How
then do you start to make this more broad-based? Because with a small nucleus in which you then concentrate in the benefits, maybe already starting to be felt, how do you then start to make different parts of the country, different parts of the economy start to access the same benefits?
If we look at some of the work that's going on in the slums from the non-government organisations, an organisation called Tushindi, Children's Trust, is ensuring that families get economic support to set up their own businesses. And this model of supporting people to keep their children with them and get a job and then come out of that charity support to be more sustainable spreads. And once you have a community that believes that they can do more and can ensure that they help themselves, you will spread that. We've seen that in other countries. You enable and empower people that then can work harder, that then changes a community, that then changes a country.
Finally, you brought up the issue of creches, basically daycare centers where women can leave their children, parents can leave their children while going to work. There's a particular dearth of that in Kenya, even for larger organizations and even blue chip companies. How do you get organizations to start to adapt this as best practice, essentially knowing that there is a direct linkage between how, well, peace of mind, performance, and of course the economic benefit of that, as well as the development of the children?
So policy always helps, but parents help too. And I think having daycare as more than somewhere that you put your child whilst you go to work is crucial. So with Fee Daycare, the care is built so that children get cognitive development, so they get play and teaching. They also get 2 meals a day. And if workplaces saw that this was something that they would invest in, like we have in other countries across the world, then they would see that their workforce were actually more stable. Children were getting less sick, so they weren't losing their workforce. And you would actually be able to build a whole workforce plan, particularly in hospitals, because I come from the sort of hospital world. Workplace daycare in hospitals means that your staff will stay, and therefore you will have better, healthier and happier staff.
Okay, indeed. Thank you very, very much, Professor Marion Lynch, Deputy Medical Director, NHS.
Thank you very much.
Well, on that very, very informative note, we want to take it to a